Hi, everyone. This is Christy Rich, and this is Holistic Me TV. We are on season 2 of Holistic Me TV, and I am continuing to bring on guest experts from all around the world to educate you about the pregnancy journey. So, if you're not familiar with me, again, my name is Christy Rich. I'm a holistic healer. I've been a healer for over 20 years. I love the work that I do. And now I'm also a writer. I'm writing a 3-book series about childbirth around the world through a holistic perspective. And book 1 is all about how to become healthier in pregnancy, labor, and afterbirth by adopting a knowledge of preconception health and also taking action to improve your health before you conceive. So I'm super excited to bring this book series out into the world. But before I do, I have this beautiful series to educate you and to continue the conversation. So today I'm very excited to bring on a guest from Georgia. So we have Dr. Amanda Shipley, and I'm going to go ahead and read her bio for you. So, Dr. Amanda Shipley is a pelvic floor physical therapist with more than 20 years of experience and is the founder of the Renew Pelvic Health in Atlanta, Georgia. Dr. Shipley is especially passionate about helping birthing people have as smooth a childbirth as possible while preventing future pelvic floor dysfunction. After having 2 unmedicated home births herself, she created her signature program, Progressive Pregnancy, where she helps women prepare their mind, body, and pelvic floor for the childbirth they desire. Wonderful. Welcome, Amanda. How are you today?
Very good. Thank you so much for having me.
Oh, it's a pleasure. It's a pleasure. So I always love to dive right into people's stories. So can you, first of all, share your story? Why do you do the work that you do? Why did you become a pelvic floor therapist? And why are you so focused on proactively helping women before birth?
Yes. So I became a physical therapist because I wanted to have more time with my patients. I started out as, well, I should say a pelvic floor physical therapist. I started out as an orthopedic physical therapist, and I just loved physical therapy. You're working with people sometimes a few times a week, and you're helping them restore their function, and we're really looked at as the muscle experts. So I loved the profession, but I quickly in orthopedics started to get burnt out. And as I got older into my journey of starting my family or seeing that on the horizon, it was quite a ways away yet, but I really got really interested in the pregnancy and postpartum space. And clinically with my orthopedic practice, I was really very good at helping people who had sacroiliac joint issues, low back pain, hip and pelvis kind of issues to begin with. So that part of the body was already kind of calling to me. And when I went into pelvic floor therapy, I had more one-on-one time with my patients. And after I had my first birth, my first child, I should say, I had a huge awakening that everything that I had learned and a lot of the things that I had been teaching my clients up until that point was not enough. And when I went, I had my home birth, but it was 30 hours and it was 2 hours of pushing and it was way longer and harder and yeah, just really a lot harder than I expected it to be because I knew what I was doing. And if you're just listening to this
Mhm.
and you're not seeing, I'm using air quotes to kind of tease
Yeah.
myself. But like, I thought I knew what I needed to know and I prepared for my birth like it was a marathon. You'll hear people say that. And that's what I got. I got my marathon, right?
Oh,
And
and how are
so
you
all
preparing? How are you, quote unquote, doing all the right things?
Right. So I thought I was ahead of the game because I was preparing my pelvic floor. I was using a dilator. I was not only doing perineal massage at the opening of the vagina, I was releasing my muscles all the way inside. I thought this is great. And I was preparing my body physically. So doing squats and pelvic tilts and things to help with optimal baby positioning inside the uterus. And so I had that awareness, but what I didn't have the awareness of was that I had a lot of fear around birth. Working with women, birthing women for so long, I could see what could go wrong, and that was in my mind and in my body, and that fear was in me, and I did not even let myself process it.
Mm.
I really, if you asked me leading up to my birth, I was so excited. I was, making my playlist, and I was consciously aware that now I'm going to have this real firsthand experience of what my patients have been telling me all these years. And now I'm going to, yes, start my family, have a beautiful child, hopefully.
Uh-huh.
From it. But that clinical side of me was like, oh, yes, I can't wait to feel this myself. It's like you're on the team, but you're always on the bench, right? So now you get to go in and play and feel what it feels like to work with your teammates and to score the goal and everything. So I
Mhm.
was really looking forward to birth, or so I thought.
But you were
And then,
afraid in the back of your mind of having
yes.
potential birth complications. Is that correct?
Yes, and that's what I processed after my birth. In the moment, when the contractions started and things started getting more intense, what my brain was telling me was, how can something not be wrong? How can something, this is so intense. How can something not be wrong? That baby's stuck. Something's wrong. I'm going to fail at having my home birth. I'm going to have to go to the hospital.
Mm.
That is what showed up in my mind. And again, not in the moment, but after the fact, processing my whole labor and birth, I could see I was fighting it all the way. I was holding on. I was making the pain worse by creating more tension in my body. The 2 hours of pushing, I promise you, my twin sister was my doula.
Oh,
And
wonderful.
yeah, she and I are like, yeah, we're
You're
identical twin
close.
sisters. And she
Amazing.
created progressive pregnancy with me. Yeah, she had a home birth as well. So she was there for the 2 hours of pushing. And I promise you, every time a contraction came, she would say over and over for 2 hours, bless her heart, she is like a saint. She would stay with me that long. Her throat must have been hurting. But she said, you're one step closer to meeting your daughter. And every time she said that, it was like I was hearing it for the first time. And I was like, oh, you're right. She had to keep like putting it in my brain, like, no, there's a purpose of this. You're gonna get to meet your daughter. You're one step closer. But in between every contraction, I would stand up and I would go to the sink. The only place my body would relax was on the toilet. So I pushed for 2 hours in the bathroom. And
Mhm.
it's very common. Your body knows what to do, and it's a place you're used to relaxing your pelvic floor. So
Yeah.
that was like the one place my PT brain could get out of my head and into my body was on the toilet. Sounds silly, but it worked. And so in between every contraction, I'd stand up and go to the sink and lean over and just try to relax for a second. And then the wave would happen. I'd sit back down and she'd remind me, I'm like, I can do this. Oh my gosh, anyway, it was long. It was really long. And I came out of that birth feeling like, oh my gosh, I'm a failure. Like, this is what I do for
Mm.
a living. And how did I almost not get my home birth? Right. And
Mm.
so I deep dived into, I kind of got out of the pelvic PT bubble I was in, and I started learning from other people, doulas and birth workers and body workers that aren't in the PT space, and learned a lot more about how to prepare for birth.
Oh,
And I used
wonderful.
all those, yeah. So then I used all those techniques and all those tricks that I learned. I mean, I started immediately implementing it into my practice and practicing on everyone I worked with, but I physically used it for my second pregnancy and really used the whole pregnancy to prepare for that birth, and got 5 hours active labor, like maybe 40, 45 minutes of pushing. It was amazing. It was the redemptive, just empowering. Both births were empowering, I will say. But that second birth was, I felt more accomplished after that. Like I had done my work and I've got this easier birth that still was hard. I mean, pushing is hard work, but um, and so it's just lit up the fire. We put that into a program, and now that's what I share with people. Besides, still my filling my passion by working with people one on one in my clinic in Atlanta. So
Okay, wonderful. Well, it's great to hear your story. I always love to hear stories, and I think that really helps the audience to get an idea why you do the work that you do. So let's continue. Let's go on. So, when is the best time for someone to see a pelvic floor therapist if they're planning to start or grow their family?
it is never too soon to see a pelvic floor therapist. I have seen people even before they conceive. If you can swing that, that would be amazing, because they're in, especially if you're having mechanical infertility or undiagnosed, they can't figure out why you're having fertility issues. Pelvic physical therapists that have the experienced ones that have The hands-on techniques can actually help you with that, but definitely, definitely during pregnancy. So I think there's a big myth out there that you should wait until after you have your baby, or maybe get one visit toward the end of your pregnancy, so that way you have that person lined up when you really need them postpartum. But that couldn't be further from the truth. The earlier that you can start in pregnancy, you can start working on things, and that pelvic floor therapist can help you have a smoother, shorter childbirth, and you can already start setting yourself up for that easier postpartum healing during your pregnancy.
Okay, okay, very good. Yeah, I think a lot of people are still not talking about this. I mean, in my world, I hear some people talking about going to a pelvic floor therapist, but again, like you said, it's normally after. It's normally after they've given birth, and it's more to heal if they've had injuries. So I think it's very interesting what you're talking about, actually doing it before birth. Okay, and do you believe that everyone should go before, during pregnancy, to work with a pelvic therapist, or do you believe only if you have certain conditions or certain worries? Do you believe it's for all?
Everyone,
Everyone?
absolutely everyone. The only thing that comes to mind, if you are at a high risk pregnancy and someone has said you should have pelvic rest, or you are on bed rest, then I would wait until you were cleared from that. So sometimes with cervical issues, and the cervix being the part of your uterus that's holding the baby in, right? You may not be able to see a pelvic floor therapist, or you can't do internal work if you have a cervical issue. But besides that, unless someone has told you that you should be on bed rest, then, or pelvic rest, then everyone, literally everyone, could benefit from pelvic floor therapy during your pregnancy.
Okay, very good to know. I think a lot of people are going, wow, I've never heard anybody talk about this. This is something new. So, why does the pelvic floor need help preparing for birth? I think this is probably a question that people who have not heard this topic being talked about have questions on. So, we know that different parts of the body automatically do their functions. The heart beats without us thinking about beating so many times per minute. The lungs fill up with oxygen on their own. Our stomach digests food on its own. So why do we need to prepare the pelvic floor? Why does it need some help?
Right. Well, I think a lot of people believe that the pelvic floor is responsible for pushing their baby out. And that couldn't be further from the truth. The pelvic floor muscles actually need to be able to lengthen and open and relax. And the uterus does the work of pushing the baby out. And in our society, we have a lot of tension in our body. There's not a lot of talk around the pelvic floor. There's this like taboo around that part of our body. Hence the reason we have 1,000,001 slang terms for your genitals, right? I tell people when I talk to them, okay, how many different terms do we have for the ear? One, we call it an ear. How about the elbow? It's just an elbow, but yet you get down between your legs and
That's
it's like
true.
a gazillion words, because our society is so uncomfortable talking about this area. And now women are supposed to be, and birthing people are supposed to be turning to this area as their power and focusing on it and how can they help it. And there's so much unprocessed fear or shame, or yeah, just the taboo. They just have a lack of knowledge about this area. So having the guidance of a pelvic floor therapist to make sure that you can connect with your pelvic floor. And what I mean by that is, when you think about it, can you contract your pelvic floor muscles? When you think about it, are you in voluntary control over relaxing and lengthening and opening your pelvic floor muscles? And a lot of times that is what people are not able to do, is that relaxing and lengthening and opening. And that is exactly what your pelvic floor needs to do in order to birth your baby vaginally. It needs to get out of the way. And also, if we're thinking about long-term pelvic health, your pelvic floor muscles need to be able to, if any muscle really truly needs to be able to relax in order to be able to contract. Muscles work on this length tension relationship. So if your muscles are tight and short anywhere in your body, short and tight muscles are weak muscles. So I have nowhere to go. I'm functionally weak. I can't generate any force because I'm already maximally shortened. And this is like under a microscope, really, really small within the tissue. So we need to learn how to relax our muscles sometimes in order just for them to be able to function more optimally. So
Mhm.
these are things you want to know during your pregnancy, before you get to your birthing time, and then before you get to perimenopause and beyond, like all these life transitions that we know affect the pelvic floor. I had a patient once who came in, and her mother had just had a bladder surgery, a surgery to support her bladder. She was having what's called pelvic organ prolapse, where your
Oh,
insides are not
yes.
as supported. Right. So her mother had kids and, had a lifetime. And so she was older and she needed to have the surgery to support her bladder. So the patient is pregnant for the first time and she was having no leaking. She was having no pain anywhere in her body. These are some things that will trigger you to know, oh, well, maybe I have an issue going on, right? She had none of that. She was hiking, she was in good shape. And so she came in really just because, for preventative measures, she wanted to have an awareness of what her body's doing because she has this family history now that her mom had the prolapse. So when we did her muscles were strong on the outside of her body, posture looked great, core and trunk movement looked great. But when we got to assess her pelvic floor muscles, she had no voluntary contraction. I said, go ahead and squeeze and lift, and she couldn't do it. When I said, okay, now let's gently bear down like you're having a bowel movement, taught her how to properly do that. She could not coordinate that. So her muscles were working on autopilot, but when she tried to consciously control it, it was like it was offline, right? And she had no awareness. So now when that person gets to birth, whether she has an epidural or not, when her team says, okay, we need you to push, she may think she's pushing, but she's squeezing and she's caught,
Mm.
there's this discoordination, and it's
Mm.
going to make that birth more traumatic, and it's going to make her pelvic floor go work harder and have more issues after that birth. And really, I saw her that one time. I gave her this awareness about her body, gave her some homework. She went away, worked on it diligently, came back 1 month later. Everything was back online. She went on to have a beautiful birth.
Oh,
So, I mean,
good.
really, yeah, it could even just be 2 visits. Even if you're not having any issues or you don't think you're having issues, we can pick up on something that is still not quite right, and can cause an issue down the road.
Oh, I'm so glad you're talking about this. I have met several people who've had the prolapse, family members and other women who I've interviewed about their childbirth stories. And it's an issue that a lot of women struggle with. It's not being talked about that commonly, and they don't know what to do about it. They don't know how to improve it. They may go to a therapist, a pelvic floor therapist, and still they're not getting the help that they need. So it's about finding the right person. But I think it's so important what you said that they need to work on this if they already have the prolapse, maybe from another birth or maybe from something else happening, that they need to focus on that before the next birth because otherwise they may have birth complications. They may not be able to push. They may not feel the muscles. And so this is what's so important is to see how it's all connected. That's why I love to talk about the importance of preconception and really thinking and having the knowledge at that point. So if something happens or if you already have a condition, you know to take action as soon as possible so that it doesn't escalate, so it doesn't become a chronic condition in pregnancy, it doesn't become a birth complication or an issue after birth. So I'm really
Absolutely.
happy you're speaking about this. So, do you want to say anything more about that for those who are out there and have prolapse? Any recommendations? I know you said, of course, to come work with you, but anything else that they can do if they have been diagnosed with prolapse so that they can have a
Yes.
smoother birth next time?
Absolutely. And even if you haven't given birth yet, if you have dealt with constipation, that is my number one thing is to, during your day, don't hold your breath ever. But then number
Mm.
two is get your constipation under control. Excuse me. So, um, yes, make sure you're not straining for your bowel movements. You want to have your knees higher than your hips when you're moving your bowels. Good position. We call it defecation posture. Good toileting posture is important, and that will absolutely help. But also a holistic approach. So managing your stress, drinking lots of water, getting enough fiber, taking walks, being active.
Yes, take a
Sorry.
sip of water if you need it. I know it's allergy season, and I know
Yes.
you're in Georgia, so
It was
you
like,
get the pollen earlier than we do. Normally in May, I'm sneezing like crazy, so I'm happy I'm not right now. Um, yeah, thank you for talking about this, because again, I know people struggle with it, and it's such a private issue. Even constipation, people don't want to talk about. They don't want to talk about again what happens in the lower regions.
And I even tell the doctors that I work with, I say, please, please, please don't just ask your patients if they're constipated, because people don't know what is constipated, what's normal and what's not. And if you look up
Mm.
online, they'll say pooping, normal pooping frequency is 3 times a day to once every 3 days. Yeah, the allergies here. I mean, the pollen is real in Atlanta, but
Yes.
so
Yeah.
anyone in the holistic space is you need to at least poop once a day, right? So that's what I
Yeah.
try to get my patients to. So we don't want to ask, you know, how, are you constipated? No, no, no. How often are you pooping? And we want to know
Right.
you're at least pooping once a day, especially before you get pregnant.
Bless
I
you.
was tickling my throat, sorry. Um, Especially before you get pregnant, because it's very common. It doesn't have to be normal, but it is very, very common to deal with constipation during pregnancy.
Yes.
And
Yes.
so, and I have treated women who have had prolapse so bad that they needed surgery and they never had kids. They just had a lifetime of straining and no one intervened. The amount of doctors and
Oh,
people that she talked and these people have talked to and didn't see the correlation that you can strain and strain and strain to move your bowels and physically wear out your tissues and then need to have surgery to fix prolapse, even if you never had a child. Usually we think of pregnancy and pushing to birth your baby as what can cause prolapse, but really years and years of straining with constipation. So I say that
interesting.
even if it's your first baby, if you know that you've had issues, and patients will tell me, oh yeah, my mom told me that, for me to have my first poop, she had to use a suppository. And like, I mean, from birth,
Mhm.
things were not good. And then it became an issue when she was aware that other people were aware that she was taking a long time in the bathroom. And so you hear these stories of people just having issues around pooping, and then it just becomes this lifelong problem.
That's so
So if
interesting. That's so
yes, if
interesting.
that's you, I mean, that's the number one thing for prolapse is listen to your body, work on your pooping. You want to have poops that look like a smooth snake in a sausage, and you want to at least go once a day. And that is before optimize that before you get pregnant and try to maintain that during pregnancy. And if you have prolapse, yes, you don't want to hold your breath at all, lifting, pushing, pulling, moving your bowels,
Yeah.
anything like
And
that.
you want to heal that as much as possible before you try to conceive, correct?
Yes, absolutely. Yeah.
Yes. And same thing if you have like hemorrhoids, you want to try to resolve that before as well.
And hemorrhoids can be from the increased blood flow and the increased pressure on the area from a growing, baby in the uterus. But it also can be from tight pelvic floor muscles. So when your muscles are so tight, blood flow is what keeps our tissues healthy, and it brings oxygen and nutrients to the tissues. So when you have really tight tissues, it's kind of like what we call a local ischemia. It means a lack of blood flow in that area. And so when you have that decreased blood flow, the tissue just isn't as healthy. When you have tight pelvic floor muscles, you can be more susceptible to urinary tract infections, yeast infections, BV, things like that, but also hemorrhoids, because the tissue is, one part of the pelvic floor may be tight and then you're straining. And so the tissue gets weakened, more
Oh.
in the back, like where you're moving your bowels. So,
Okay, so this is very interesting. I didn't know this conversation was going to go this way, but it's all connected, right? So if
mm-hmm,
you
mm-hmm.
have had a birth and maybe you had the epidural and you couldn't feel to push and you used the muscles and you overdid it and you got prolapse, then also you can have problems going to the bathroom. And this can also even affect your bladder as well. So it can create like a number of issues. That's why it's so important once you have one issue, get some help before it escalates and then creates other issues as well. Correct?
And this is, yes, and this is why I love educating people to start before you have the need, right? So it's
Yes,
always easier to
me
catch
too.
problems when they're smaller before you've had multiple births. There's never too late to start pelvic floor therapy also. So please don't feel hopeless if you already are dealing with all the things and it feels really daunting right now. Your body every moment of every day is trying to heal itself, is trying to get back to feeling good and
Yes.
just functioning the best that it can. So trust that it's always working on your side. It's never too late to begin, but we know that pregnancy, no matter how you give birth, whether it's C-section or vaginal delivery, affects your pelvic floor. And
Hmm.
we know that your pelvic floor is going to affect your birth. So let's start before that whole transition where you become a mom and you now have other people depending on you. Let's get you in touch with your body. Let's get your body functioning optimally, feeling its best, not having any leaking. There's a lot in our society that we think is normal, and it's just common. Common does not equal normal. That means
Exactly.
that a lot of people deal with it, but a lot of people don't. So it doesn't have to be a reality, right? So leaking during pregnancy, pain during pregnancy. Like I said, even if you're not having any issues during pregnancy, it's really good to see a pelvic floor therapist. And what you can learn is how to connect with your pelvic floor, how to relax and open, how to push for the second stage of labor. And the best thing is if someone can help you with an internal exam. So with my finger inside, I say, okay, I teach the person how to push, and then they have the practice, and I can say, nope, that wasn't quite it. Oh, yes, that was it. That was it. And they can feel in their
Oh,
body,
wow.
oh, okay, I know what I did. That's what we should be training everyone. This is why I say everyone should have at least one visit before you give birth, ideally as soon as possible, so
Yeah.
that way you have your whole pregnancy to practice pushing, especially if the first time you try, it's not quite right, right?
Yeah.
But we also check for two things. We check for, can you do it? Can you coordinate it properly? Are you squeezing when you mean to push? But then also, okay, yes, you can push, but are you pushing effectively? Are you pushing with good power? So we want not only to just do it right, we want to do it well.
Hmm.
So these are things that you can learn either with, our online program teaches it, but if you can have even one session with an in-person pelvic floor therapist that's experienced, that's comfortable doing internal work with you during your pregnancy, and you can ask them because some newer grads may not be comfortable, but yeah, we do it with everyone. Visit one if you're comfortable,
Wonderful.
at my
Wonderful.
practice.
I think that's
Yeah.
great. I think I haven't heard of anyone else doing what you do, so I think that's fantastic. And again, I love that you said it's never too early. And I'm all about, even in preconception before you're pregnant, like start working on your health, start getting in touch with your body, start relaxing your mind, start getting over your fears. So let's talk a little bit more. You said that often people are very tight in their pelvic floor. So when you work with them, are you also helping them to relax their mind and to focus on their fears and to let them go? Do you see a connection between the mind and the pelvis? Tell me more.
Oh, absolutely. Absolutely. So, what we know are pelvic floor muscles are stabilizing muscles. The pelvic floor has five jobs to do in the body, but one of them is to work with other muscles to act as a stabilizer for your core. And what we know now with research is that stabilizing muscles are anticipatory muscles. So they've done studies and they said, okay, they hook people up to electrodes and say, all right, go ahead and stand up. And when you think about moving, that's when your pelvic floor fires. It's on before you're even moving. And then when you're actually moving your body in space, your quads or your glutes, like the big movers in your legs fire. So what this shows is that your pelvic floor is responding to your thoughts, and your body is always in the present. It doesn't know past or future. It doesn't know good or bad. So you could be eagerly anticipating that baby and working on that nursery, or you could be stressing about something that happened at work yesterday. Your body's like, oh, you're thinking, we're ready to go. So this is why the number one thing we teach in our practice, both in my online program and in my physical in-person clinic, is this awareness of that mind-body connection with the pelvic floor. And I tell people, even if you have a workout program from a pelvic floor therapist or something you found online, that's a minority of your day. If you're spending the rest of your day mindlessly busy, 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 right? And I jokingly say, what woman shuts off her thoughts? Like, I know I don't.
I
So we
have a
have
lot
to
of thoughts
create.
too.
Yes, exactly. This
Overactive
thinker
brain.
does not stop thinking. Yeah, exactly. So it's just that awareness that we think, okay, I'm gonna go to the gym and hit it hard for an hour, 30 minutes, whatever it is. And then the rest of the day we're sitting or we're just work, 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 then we need to create space in our day to focus on our pelvic floor, breathe into our pelvic floor. And so that's number one that we teach. And how do you do that? So there's certain positions you can put yourself in that help relax your hip flexors and your iliopsoas muscles, and that's a great time that you can kind of work on that mind body connection. But truly, that's a tip I could leave with your audience today, is checking in with your body every hour, creating the space to have an hourly body check-in. So you see, am I holding tension? Try to release any tension, but then breathe into your pelvic floor. And the trick is, when you inhale is when you want to feel your pelvic floor muscles relaxing and opening like an O, and or relaxing down towards your feet, because that's what it does. The pelvic floor opens, but also lengthens and relaxes downwards toward the feet. So as you're inhaling, you want to clear your mind. That's the most important thing, is to stop thinking about anything else and open and like relax your pelvic floor with the inhalation. And then as you exhale, everything just gently comes back. And so doing that consistently, even if it's not every hour, but as often as you can during the day, so you're not just mindlessly holding this tension, that's going to help your pelvic floor muscles feel better. It's going to help them function better. You're going to be in a better shape heading into your birth. I've seen it help people who have pain. It decreases pain. It helps people stop leaking within just a week of really committing to having these daily body check-ins.
Hmm.
It's very powerful.
Interesting. Fabulous. Can you share some misconceptions about birth from your
Oh,
experience?
yes. Yeah, the number one, I work with a lot of holistic people and holistically minded people. And the number one that I think I hear is that, well, birth is a natural process. My body knows what to do, so I don't need to do anything to prepare for it. Or they say, oh, I'm going to get what I need in my childbirth education class, right? I'm going to show up for that day with my partner, and I'm going to learn the hip squeezes and the different stages of labor, and that's all I need to know. Um, I think those are two of the biggest one. Oh, and then the other one I would say, I think we already touched on, is that, in order for me to not leak or not have issues afterward, in order for me to be able to push my baby out, my pelvic floor needs to be strong. And I need to do Kegels and strengthen my pelvic floor. And that's the preparation that I need to do. Those I think, are like the top three that I hear.
Mm-hmm. Mm-hmm. Okay, great. And any other tips you want to share with the audience so that they can prepare for birth?
Oh, yes. Another top tip, I would say, if you are pregnant, and honestly, even if you're just thinking about being pregnant, I recommend this for you to start getting in the habit, because sometimes these are hard habits to break, right? Is you want to stay balanced in your pelvis. So when you're pregnant, your body has a job to do. But when you're going to give birth, your baby has a job to do too, and it has to rotate and descend, and that is going to help labor progress smoothly. So if you have these habitual patterns of crossing your legs or sitting with a leg tucked up underneath you, then that can restrict the baby in the uterus and restrict its ability to move and rotate and descend when the time comes. So these are things that you can be working on during your pregnancy,
Mm-hmm.
staying balanced. So don't cross your legs, don't sit on one leg, don't wear heels at all if you can help it. And if you have to for work, a kitten heel, the smallest that you can get away with. And then I would also look for any habitual patterns. So for me, I am kind of a nerd about this. I think about it all the time, but I notice it's a constant struggle. And I'm not having any more babies, but when I go to flush the toilet, when I put on my makeup, even when I wash my hands, I'm always leaning to my right side. So I constantly have to shift my weight to the left. You want to try to keep your weight evenly through your pelvis as much as you can. And when you sleep, you're off the hook. So people always ask me that. Well, what if I'm all twisted like a pretzel when I wake up? Totally fine. You're not up against gravity. Don't worry about it. Unless you wake up in pain, and a pelvic floor therapist can help you. Sometimes I have people wear an SI belt to bed because they need more stability, because they kind of pretzel themselves when they're unconscious. So if you're having pain, see a pelvic floor therapist. Or when we talked about the breathing and you can't feel your pelvic floor relax, that would be a good reason to see a pelvic floor therapist. But that staying balanced is really key, and I don't think gets talked enough about. And you
Yeah.
see people in the media and they're looking so cute with their little bump and their super high stilettos, and I'm like, oh god, you're gonna get a C-section. Like you're asking. I'm
Oh
like, oh,
no. Oh
it's
no. Yeah.
there's so much you can do to, and heels is one thing, at least during your pregnancy, kick the heels away.
Okay, very good. Take off the heels, ladies. Don't cross your legs. So since you've had two home births yourself and you're very passionate about helping home birth families, do you have any specific tips for people considering a home birth?
Yes, yes. A, you're not alone. and you're not crazy and you're not being unsafe. I think although home births in the US, this is 2025, they're rising, they're still only 3% of the births. So I
Oh, is
know
it
it
that
can,
much? I thought it was still 1%.
yeah,
I guess it
the
went
last
up
I
a little
saw,
bit during COVID.
hmm
Yeah.
I think from COVID, exactly. So just know that we're still a small percentage, but you're not alone. And the number one tip would be to start protecting your mental space. And don't watch scary things. Don't, especially around birth, and I would really kind of protect your space to, what information you're taking in. And I would absolutely um, empower you to gate, like try not to, you don't have to tell everyone that you're having a home birth. So when I was pregnant with my first and I was thinking that I was going to be doing a home birth, I didn't share that with my patients. I didn't share that with even family members if I didn't think they were going to be aligned and they weren't going to be supportive.
Hmm.
Because even well-intentioned people that really care about you doesn't mean that they necessarily are knowledgeable about birth and about home birth.
Hmm.
So as long as you're linking up with a experienced midwife who is going to assess that a home birth is a safe option for you, because sometimes home birth is not an option, but any good midwife will be able to tell you, yes, I can take care of you. Yes, I can handle this with you at home. As long as you're working with a good team, you're not being irresponsible. But people who don't know will tell you otherwise and just give you their opinions, and you don't need anyone's
Yes,
opinions.
and then
So
share the horror stories. People love to share the horror stories to
yes,
educate, and that's not really a way to educate, that's a way to spread fear and also
exactly.
misunderstanding as well. So I
Right.
think it's
And that
very,
can be well intentioned, but it's not.
oh,
And then, oh,
yes,
the other
very
thing I
much.
would say, number two, would be to process your feelings around birth.
Yeah,
So again, you
very
can think
important.
you're really crunchy, all your friends had home births, and you want to have a home birth, or maybe you're the only one out of your friends. But I would say creating space in your day, and we talk about that in our online program. We talked a little bit about this, having those check-ins, giving your body some time and space to process. How am I feeling? And it's okay if something shows up and you say, oh my God, what if this happens? Talk to your partner about that. Talk to your midwife about it. Talk to your team, your doula. So that way,
Therapist,
as these,
healer.
yes,
Yeah.
therapist, hello, totally. So if you can process those emotions, it doesn't mean that you're not going to be able to do it. Like it just means you're normal, that you have fears and concerns. You voice them, you get them out of your body, then they won't show up in your birth.
Yes, this is very important. I want to star this because of the women who I've interviewed for my book series, this is what came up often is that many of them had fears. Many of them had fears from the media, from movies, from horror stories they heard from other women, or just like in their DNA, they just were always afraid of birth. Or maybe they were afraid of being a bad mother. Maybe they didn't have a close relationship with their mother and they were afraid of becoming like her. And even in Ina May Gaskin's book, I love her, Spiritual Midwifery, she shared some stories of women who had longer labors, and it was because they had fear and they hadn't expressed it. And once Ina May sat down with her and say, okay, what are you really afraid of right now? What's holding you back? And then she just expressed it during the labor, then she was able to let go and release. So it's something that people think, well, okay, yes, I'm afraid, but everyone's afraid. But we need to process this because like you said, the body holds all of our emotions and it thinks everything is, stressful right now or an emergency right now, and it wants to protect itself. So you want to make sure the body feels safe when you're giving birth so that you can release and have the baby.
Absolutely.
Yeah. And I want to talk a little bit more about home births because, again, I believe there's not enough education about it. It is safe. It is important that you have a midwife who will be supportive of you and also will be open to transferring you. I have heard some stories of midwives saying, no, I don't believe in hospital births, so I'm not going to transfer you. So you really need to interview your midwife to make sure their beliefs and what they will do for you because we never know what's going to happen in birth. It's always very unpredictable. But It is safe and it's not being talked about enough because it's so common for people to have hospital births. Okay, it doesn't mean that hospital births are better or safer, it's just more common. And it used to be the opposite, 100 years ago, it used to be more common for everyone to give birth at home and nobody thought about going to the hospital. And actually, when people started going to the hospital, they had more fatalities because doctors didn't know to wash their hands. So we just have to take everything into account. And even if you go and you take the childbirth education classes, they may not talk up home births because, again, they are conditioning you to prepare for a hospital birth. So I just want to echo that. And I also want to say it's important because when you go to a hospital, a lot of times everything will be very, very fast. They want action, they want to keep busy. And as Amanda was saying, you naturally want to relax and be open, and that will help you to give birth. But if you're scared, if you're protecting yourself, if everything is like coming at you every few seconds, and what do you want? Do you want this? Do you want that? It can put you in that freeze mode or that protection mode, which will make it harder to give birth. And that's also why birth takes longer, oftentimes at a hospital.
Absolutely. Absolutely. And the bright lights. So you get
Yeah.
in there and it's just all bright lights, and our body is meant to like hunker down and have dim lights and have it be quiet. And I do think the monitoring, home birth midwives monitor. I remember being annoyed with mine. I'm like, get that thing off my belly. But every 5 minutes or however often it was, she'd have her little Doppler on my belly, looking for the heart, listening to the heart tones,
Okay.
and okay, baby's doing great, listening during a contraction, not during, they do monitoring, but it's less than a hospital. And the hospital is like so much monitoring. It limits how you can move a lot of times.
Yeah.
Um, it is. And so a lot of times people will try to labor at home as long as possible. Then they get to the hospital knowing labor is going to stall for a little bit. It's going to slow down because the body is going to say, this is not safe. Right. And I chose home birth because I knew that I would feel safer at home. And it was still hard for me the first time, it's like, thank God, I was at home and I had a really educated, talented, experienced team on my side. Yes, absolutely. And I will say that some people just, they just don't know about home birth, right? And so home birth, we're not saying free birth. We're not saying you're just going to have birth and a friend shows up like, oh, I witnessed this. No. Home birth midwives, trained home birth midwives are trained in infant CPR and resuscitation. They are trained to do the APGAR scale, all the testing for the newborn after the baby's born. They are meeting with you just like an OB would meet with you. They meet with you throughout the pregnancy. They do all your prenatal visits.
And even
They're
longer visits than OBGYNs.
they
OBGYNs, I
do
think, is like 7 minutes, and I think a midwife is at least half an hour, right? Maybe an hour.
or an hour. Yeah,
Yeah.
mine had a business model. She would come to my house. So she didn't pay for an office. She literally came to my house, which is so great. I had the same person for both
Wonderful.
my births. Yeah. So when I already had a little one, she could play, and my OB visits were well, OB, my midwife visits were so great because she would just come to my house and we would talk about anything that was on my mind and food and then postpartum they're there, they're processing your birth with you to the next morning, and then
And
they
again,
come
coming
back.
to you.
Yes, then they come back and they come back and they come back more often, and they are so helpful, and I really do think you just get more attention. And
Yes.
and if you're a low risk pregnancy, it really is a very safe option. And also I will say there are different midwives, right? So there are CPMs. So that was my midwife, was a certified professional midwife, meaning she actually learned from Ina May Gaskin on the farm. And
Oh, wonderful.
she
How exciting.
Yes, like she knows her, and they are just, yeah, I mean, so she's learned all this like traditional ancient knowledge that has just been passed down. And then you have CNMs, which are certified nurse midwives. So if you say, okay, I don't want to be in a hospital, but I don't know that I want to go this more traditional midwife route, then you have, so a CNM is a person who has been certified in a Western medicine accredited school to be a nurse midwife. So they could work in hospitals or they can work at home. So I have a lot of patients that go that route. They hire a CNM who's doing home births, and they can deliver medicine, and they can do, at least in Georgia, they have a little more
Oh,
rights.
they can deliver
And
medicine. Okay.
Yeah, and so they can, yeah, like give you fluids and they can do other things. Yeah, so just know that there are even variations within midwifery if you feel like a little more aligned with the traditional medical model, but you want to do it in your house, and maybe a CNM would be something. And I would absolutely interview your midwives. We teach this in our program that, and we give you questions of what to ask, but you can definitely ask them, what is your transfer rate? So if their
Yes.
transfer rate is like 50% or higher, that's pretty high, right? So, there's some local midwives I know that their transfer rate is super low. The meaning
But you also
that
want to ask them if they will be willing to do a transfer. Because again, I've heard some
exactly.
horror stories saying, "No, I will not transfer you," or also sometimes they lose their rights. They're not able to continue care if you
Well,
go to
that's
the
true.
hospital. So then you have to know you're not going to be working with them. But you really need to interview them and first find out, will you transfer me if I need to for more assistance? And
Yeah.
of course, they will be honest with you. Also, I do want to mention that midwives can deliver breech babies. So, this is very important because, again, people think it's not safe to have a home birth, but they are skilled. They know how to deliver breech babies. But if you go to the hospital, OBGYNs are often not trained to deliver breech babies, so they will say you need to have a C-section. So, this is something very important to consider as well. But I want to get more into how you help your clients, how you work with them. So, can you tell us how you work with your clients one-on-one and also tell us about your digital program?
Yeah, so I poured my heart and soul into this progressive pregnancy. You can find it at progressivepregnancy.com. And it is what do you call it, self-paced online program. So you have instant access to all the modules. We have coaching calls once a month with me. So you do have contact with me to ask questions live, or you can email them in and we'll answer them, and you can catch the recording. All the replays are in there. And it has a module on setting up your environment. So that's your questions for the midwife, and setting up your, getting your birth team in order. And then we have a physical preparation section, and then we have a mental preparation section, and lots and lots and lots of videos and content in there. And then we also have another section we just added on postpartum healing. So early postpartum healing, what to do those first 6 weeks, even before you may get back into see your pelvic floor therapist. Although you don't have to wait 6 weeks. If you're having pain, you can absolutely just go back as soon as you need to. But and then great videos on the proper way to hold a car seat for your partner. You should not be picking up a car seat in those early weeks, but if you can help it. But also how to wear a baby in a carrier, how proper posture to stand and change a diaper, and just to go about your day, pushing a stroller, things like that, baby care kind of activities. And yeah, so that's progressive pregnancy. And then
So
in
who is the
person,
program for? Want to make sure that everyone's clear. Who is this program for? Is it for those who would like to have a home birth specifically? Is it for everyone to prepare? Who is your ideal
yes,
audience?
I have to say it is, we catered it to home birth, people who are looking to have a home birth, because that's my wheelhouse. So I didn't pack hospital bags. So, if you're looking for that, like I don't tell you what to pack for a hospital bag in this program.
Hmm.
But it's anyone who's wanting to create an intentional, and trying to improve their birth experience. So I find a lot of people who have already had one birth experience and it didn't go the way that they wanted to, even though they know they're going back to a hospital or they know they want an epidural, they want to be more intentional. So it's anyone who's planning for birth really can benefit from it, because it's setting your body up for success for that postpartum healing as well. But I have to say the environment, or like the prep kind of section, is really geared toward home birth. So if you're having a hospital birth, or you're even having to do a C-section because of some complication, and you kind of know that going in, you can still work on the physical and the mental preparation sections, and prepare. So it really is for everyone. But when you go to the homepage, you'll see we talk about home birth because that's our experience.
And it's for the whole journey, pregnancy, labor, and postpartum, correct?
Correct. Yeah. And the way we look at it, you still can take a childbirth education class, right? So you can still take a class that the partner's going to learn how to do a hip squeeze, and but what I find a lot of times is that when you only are taking a childbirth class and they're teaching you these are the stages of labor, for me and my birth, that didn't help me at all. And a lot of my clients, that's what I find, is that they stay in their head like, okay, when is this going to be over? Where am I at? Oh, and they're trying to assess what stage they're at to how long is this going to be?
Yeah.
Oh, and then they check them, oh, I'm only 3 centimeters dilated, and they get defeated. You can go to 3 to 10 centimeters in like 2 seconds, right?
Yes. Yes.
So, I mean, a few
Very
minutes, but
important to know. Yes.
it
It
can
can
be
be very
super
quick.
fast. Yeah, so I find that if you just do that traditional childbirth ed that focuses on that one day, that one point in time, then it may or may not help. Where this is a program that you take as soon as you can, that you can be working on throughout your pregnancy, that gives you something to work on, that helps you with that one day, but also helps you for lifelong pelvic floor health.
So it improves your health overall. It's not specifically to have a 5-hour birth or a very quick birth or a pain-free birth. It's to improve your overall experience so it's better than it was the first time, or if it is your first time, to have as good a experience as possible. Is that correct?
Yes, yes,
Okay,
yep,
very good.
exactly.
Wonderful.
And
And
then
your
if you're
one-on-one?
in
Oh, go ahead.
Yes, yeah. So then if you're in the Atlanta area, really anywhere in Georgia, you can work with my team or me at Renew Pelvic Health. And we do virtual visits. So if you're outside of Georgia, I can do like a coaching call, but my license is just within Georgia for you to be a patient of mine. So you can do that in person or virtual. And then outside of Georgia, we do like a 30-minute coaching call. If you just want to pick my brain or you want to chat about anything, we offer that as well. So,
Okay, great. Fabulous.
and I'd love to just give your audience one more thing,
Sure.
that you can download a free training on how to prepare for the intense sensations. I won't say pain, but the
Yes,
intense
important to
sensations of labor.
our
Yes. And
language
I
is
love
very important.
it is. It is. It doesn't have to be painful, but it can be an intense. And so that free training is progressivepregnancy.com/free training. And you can actually start working on that even when you're just thinking about conceiving. You're not pregnant yet. This is a great move that does not involve ice that you can be doing to help your pelvic floor and help your pelvic alignment and help you prepare for those intense sensations of labor.
Wonderful. I'm always about pre-conception to start preparing. So that's fabulous. Thank you for the free gift. And any other ways that they can follow you, get more information, other websites, social media?
Yeah, so we're pretty more active on Instagram. I'd say we have progressive.pelvic.ed, and we're starting to also work with Progressive Pregnancy as an Instagram. But if you look at that page, that one's newer. And then I have my Renew Pelvic Health. That's the Instagram handle for that. We are on Facebook as well, but Instagram, I think, is more where we kind of show up. I have
Okay.
a love-hate relationship with social media, so
I
I'll be
do
honest.
too. I do
I'm
too.
like,
I
so
know. I hear you. That's why I'm going more towards YouTube and Substack. It's a lot friendlier place. So we will put all of your information in the show notes. So everyone, make sure you go to the show notes for more information. Click on those links, follow Amanda, and prepare for your birth. So Amanda, thank you so much for being here today. Thank you so much for sharing your expertise. Thank you so much for educating us and inspiring us. And I would like to invite all of you who watched today to give us a like, to give us a comment. If you have a question for Amanda, go ahead and leave it below. She will circle back and answer that for you. And definitely subscribe. So subscribe to this channel, and then you will be able to hear more of Holistic Me TV. We have other guest experts coming on and also more solo episodes this season with me. And so we will be continuing the conversation, and also follow me on Substack. So I'm on Substack now, and it is a friendlier community. I absolutely love Substack. So go over there. You can look up my name, Christy Rich, or you can look up Healing Childbirth. That's the name of my publication, and subscribe. And then you will be hearing about Holistic Me TV, about my events, about upcoming anything and everything. So definitely follow me there. And I hope you have enjoyed this episode. Let us know below what you learned today. We're always curious to know. And share this episode, share this information with friends. I think it's very important that women know about pelvic floor health, that they know about home births, and that they know it's important to prepare before birth, that you can empower yourself, you can improve your birth experience, even if you had a very long experience like Amanda did the first time, even if you had birth complication, even if you had trauma, you can heal that and you can improve and have a much better experience next time. So I hope this has inspired you. And again, don't forget to give us a like and a comment, and we hope to see you next time. So thank you so much for watching Holistic Me TV. Bye for now.